Let's talk a little bit more about HIV and AIDS. HIV, remember, is the virus that causes AIDS. It is an enveloped retrovirus. The enveloped word, remember, describes the fact that this virus contains a membrane that surrounds the capsid and nucleic acid inside. The fact that it is a retrovirus indicates that the nucleic acid is, in fact, RNA and not DNA like it is in most viruses. This RNA molecule is then copied into DNA once it enters the host cell. There are two different types of HIV. There's type 1, otherwise known as HIV-1, and type 2, or HIV-2. The one that is most commonly found around the world is HIV-1. That is also the most common cause of AIDS worldwide. However, in West Africa, HIV-2 is more common. Most of the drug treatments that we have to treat HIV these days are targeted for HIV-1. How is HIV transmitted? Well, the most common way HIV is transmitted is through sexual contact with an infected partner. This sexual contact could be male to male, male to female, female to male, or female to female. In fact, that is the order of likelihood of transmission, with male to male sexual contact far more likely to transmit HIV than female to female. The reason for this is that HIV is transmitted through the transmission of bodily fluids, and male to male as well as male to female contact is much more likely to transmit these bodily fluids. In addition, male to male sexual contact as well as male to female sexual contact in which anal sex is involved is the most dangerous because the injury during anal sex that occurs to the lining of the anus increases the risk of transmission of this virus. Contact with blood and blood products contaminated with HIV can also lead to transmission. This is the case of people with hemophilia in the 1980s, when about half of those who had hemophilia ended up receiving blood donations that led to HIV transmission. Also, sharing of blood-contaminated needles and syringes. Your book has some really interesting case studies embedded in this section about the opioid epidemic and how that has led to an increase in HIV transmission in the United States today. So using and sharing blood-contaminated needles and also accidental needle sticks with healthcare workers can also lead to HIV transmission. HIV transmission can also occur from mother to unborn child if HIV crosses the placental barrier. This happens about 25% of the chance if the mother does not receive antiretroviral therapy or if she breastfeeds after the baby is born. However, the risk of this transmission to the baby is reduced to only 2% if the mother receives antiretroviral treatment during her pregnancy. HIV can also be transmitted at the time of birth by vaginal secretions. So the best way to minimize HIV transmission is to use antiretroviral treatment during pregnancy, have birth by cesarean section, and not breastfeed afterwards. Finally, pre-mastication is another way, though a low risk, that HIV can be transmitted to parent to child. This is essentially when parents chew food prior to feeding to their infants during the early phases of introducing food to their children. This is a common cultural practice in China and Africa. Now, your book describes 3 different stages of HIV infection, but in fact there are 4. Your book ignores the first stage of HIV infection that all infections have, and that is the incubation period. The incubation period exists for about 2 to 4 weeks. So between the time of transmission and when you experience the first symptoms of an HIV infection, that is about 2 to 4 weeks. Then the next stage is the acute HIV infection stage. During this period, most people experience flu-like symptoms called acute retroviral syndrome. This is associated not only with flu-like symptoms, but also a rash on the skin, though it is itchless and painless, so many people don't notice these various symptoms. This lasts for about a month as well. The third stage is clinical latency. This is when there are no signs or symptoms of HIV present. The HIV virus is replicating inside the body and is becoming a permanent part of helper T cells in the host's body. This clinical latency period tends to last anywhere from a year to about a decade without any medical treatment. However, with medicine, this clinical latency period can last several decades, providing individuals that are infected with HIV an almost normal lifespan. However, without medical treatment, eventually clinical latency culminates in HIV replicating so much that the viral load rises and helper T cell counts begin to drop. When the helper T cell counts drop to very low levels, this is when the patient enters the AIDS stage. AIDS is defined as a helper T cell count fewer than 200 helper T cells per microliter of blood. This is extremely dangerous in that it opens that patient up to chances of acquiring opportunistic infections, leading to things such as Kaposki's sarcoma and non-Hodgkin's lymphoma. There's also, not uncommonly, bed sores and wasting syndrome, where there's loss of more than 10% of body weight due to fever or diarrhea. These individuals are severely immunocompromised and can sustain and remain alive for a little while if placed on antibiotic treatments. However, it is not uncommon for common infections such as tuberculosis, Streptococcus pneumoniae, and Toxoplasma gondii to infect these patients and cause debilitating diseases. It's also not uncommon for people in the AIDS stage to acquire very rare diseases and die from these. Patients that are infected with HIV and progress to AIDS end up dying from other diseases that they are susceptible to because their immune system is weakened. HIV is diagnosed in hospitals using 2 successive blood tests. The first blood test is to look for antibodies in the blood serum. This is essentially determining whether or not the immune system has responded to the presence of HIV in the body. If this comes back positive, the next test is to test for the presence of nucleic acids that are associated with the HIV viral particle. If this is found positive, then the patient is reported to be positive for HIV. Treatments for HIV is to have these individuals go on antiretroviral therapy, or ART. Antiretroviral therapy involves a cocktail of drugs, which is why this is sometimes referred to as a drug cocktail, that combines at least 3 different drugs that target HIV replication in at least 2 different ways. One of the first types of drugs that was licensed to be used against HIV was AZT, or azidothymidine. AZT is an inhibitor of the enzyme reverse transcriptase and acts in the early stages of preventing DNA synthesis from the RNA virus. This prevents the ability of the virus to copy itself into DNA and then integrate the DNA molecule into the host cells. Again, this is not a cure, but can help alleviate HIV viral replication inside the body, keeping the patient from progressing to AIDS. Similarly, a second class of drugs called protease inhibitors has also been developed. These interfere with final assembly and maturation of the virus, keeping the virus from being released from infected cells so that it is minimally infective to other cells in the body. By slowing down the ability of the virus to infect additional cells in the human body, this slows down the progression to the final stage of AIDS. There is no official cure for HIV or AIDS, but being on ART for decades can allow an individual to live an almost normal lifespan. Next, we're going to talk about genital herpes. Genital herpes is part of the herpes virus group. Remember that chickenpox and shingles, the varicella zoster virus, also is a member of this group. Herpes is caused by a virus within the herpes virus family, and that virus is called herpes simplex virus. There are 2 types of HSV, or herpes simplex virus. There's HSV type 1 and HSV type 2. HSV1 is a type of herpes that more commonly infects the lips and mouth, whereas HSV2 is more commonly associated with genital herpes. However, as a result of oral sex, HSV1 viral particles can infect and cause lesions on the genitalia, and HSV2 can infect and cause lesions on the lips. Generally, after the initial incubation period of 4 to 10 days, HSV1 and HSV2 can result in an outbreak where there is a large number of painful sores accompanied by a high fever. Once acquired, herpes simplex viruses become an integrated permanent part of the host cell's DNA, and thus cannot be cured by any medicine or from the immune system. Instead, this virus takes up a period of latency and will reemerge, causing symptoms of the painful lesions in years to come whenever the patient ends up being stressed from environmental factors like UV light, poor diet, poor exercise, or aging. Transmission occurs by direct skin-to-skin contact, even with individuals that have HSV but are not expressing any lesions at the time. Genital herpes is extremely common in the United States. It's in fact the second most common sexually transmitted infection in the US today. There are treatments to slow the severity and occurrence of the outbreaks, including acyclovir and other cyclovirs. We'll talk about genital warts in the next section.